Hello out there, and thank you so much for joining me today on the Happy Farm D podcast. My name is Chris Bakley, and I'm your host. Today's episode, we are going to focus on discussing the COVID-19 pandemic. And before you say that you're already exhausted of hearing about it and, day in and day out, COVID-19 this, COVID-19 that, I think today's episode is really going to spike some interest, especially regarding that it's going to be through the eyes of a emergency preparedness pharmacist for her local state department. So today we're going to speak with a pharmacist that, day in and day out is dealing with different issues regarding the pandemic, but through the eyes of a pharmacist. We're going to focus on a few things regarding PPE and some shortages you may have not heard about, or maybe you have and you're experiencing them yourself, and also just some other issues regarding the pandemic. I'm really excited about this episode and would love to welcome Miss Tracy Dabbs. All right, welcome today to the Happy Farm D podcast. Today I have pharmacist Tracy Dabbs, and she is a emergency preparedness pharmacist for her state's health department. Is that correct?
That's correct.
Perfect. Well, welcome so much, Tracy. Thank you so much for being on the podcast today.
Well, thanks for having me today. I appreciate it.
I was really worried. We just talked about. I was really worried about messing up saying what your true title was, but I think I got it for the most part. So today we're gonna do a deep dive into the crisis of COVID-19. So let's begin. What have you been working on so far?
So at the beginning of March, I was helping the state. We had a COVID-19 hotline. And when we originally started at the beginning of March, there were two people. It was me and another individual. And then from there, it bloomed into 16 people. And we were doing shifts in the morning and shifts in the evening. So 8 people in the morning and 8 in the evening. And it was a hotline for people that had concerns about COVID to basically call in and ask questions. And we were under the guidance of a medical epidemiologist at the call center. So if we were asked a question we didn't 100% know the answer to, we could basically put that person on hold, get the answer we needed, and come back to them. After that, we were activated in our state. And since then, I've been working about probably an average of 65 hours a week. We're coming up on week 8 now since we were activated. So I am Monday through Friday, I am working at our state's warehouse where a lot of our protective equipment's been going out, our personal protective equipment, the PPE. And I'm there Monday through Friday. And then on the weekends, I am home where I'm, quote, rested, but really I'm just on call. And so a lot of what I've been doing has been in response to the PPE. I've also been working on ventilators because there was a concern about ventilator shortages in the state. And with the ventilator shortages went medication shortages because, as I've explained to several people that don't necessarily know how a ventilator works, you can't really work a ventilator without medication. And we experienced, not only in our state, but nationally, drug shortages with the medications for vented COVID-19 patients. So I've been a little busy.
No, it sounds like 65-hour weeks. That's crazy. And just before we dive, right into, I want to start with the PPE part. What, just for people who are curious in terms of with the type of pharmacy that you do normally, what are you doing before the crisis started? I'm just curious. So what are you doing on a regular day?
I'm a subject matter expert to PhEP, and what PhEP is, that's PHEP. That is public health emergency preparedness. So any questions that are related to emergency preparedness that needs a pharmaceutical aspect, that's me. My main job is I help run and this will come into play in this call, I manage it was originally controlled, or I should say supervised by the CDC, but it's been switched over to ASPR, which is the Assistant Secretary for Preparedness and Response. It's basically a bioterrorism program. So medications are housed throughout the country, and it's in case we have a nerve agent attack or even organophosphate poisoning, so insecticides. So like rural areas where they use a lot of pesticides. So I help manage that program with ASPR in the state. And that's one of my biggest roles. And also just being a subject matter expert when we, for example, in January, February, we were doing pan flu epidemic exercises, which came great because then COVID happened in March. So I was on the panel with that regarding antiviral therapy. And then also just being an advisor for, if cold chain management for when you have vaccine.
Awesome. Very cool. Okay, so I know in terms of being a subject matter expert, you are now a expert in PPE.
Oh,
Is
yeah.
that correct? So
Oh, yeah.
how does one get that title?
So you basically show up to the warehouse where all the PPE is going out, and it says, "Hey, you're going to be an expert on the PPE," and I'm like, "What?" Nah. So I did have some training with it, and I have to say I have some great individuals that I work with, and I have, no joke, a guy that I work with that his title is the WMD coordinator, weapons and mass destruction coordinator. So his specialty is chemical, biological, radiological issues. So like we had someone, his PPE is a strong suit of his. So I had to have a crash course though to catch up with him. So it's a lot of education. I had some knowledge prior with the N95s simply because I had to with the type of work I do with the bioterrorism program, but I had to come up to speed with some of the PPE now that they're using for testing, such as the face shields. And then what type of setting N95 is appropriate for versus a surgical mask and a face mask. We had some new PPE come into the American market that's called a KN95. That comes from the Asian market. It's a non-NIOSH approved mask that comes out of China. And if you haven't seen one before, I actually have one in my purse. I might actually take a photo of it and send it to Alex so people can actually see it. But it's better than it's a filtered face mask. So it's better than a surgical mask, but it's not as good as an N95. So we've been pushing a lot of those out to non-clinical settings, such as law enforcement, fire, EMS, things like that.
How long are those, if they don't get contaminated? Let's say you're just wearing them in public. How long are those recommended to be good for before swapping them out?
That's a good question. I can't find any reuse data on the KN95 simply because they're so new to our market. So I've been advising people that if it becomes contaminated or if there's an exposure risk that you're aware of, then you need to take it off and put on a new one. But if you're in a setting where there's low exposure, then the CDC for N95s, the guidance now is 8-hour shifts or 5 patients with the same type of clinical setting. I know, right?
Yeah.
So that's the same advisement I was doing for the KN95s.
Gotcha. So basically, for a police officer or fireman,
Mm-hmm.
they would basically want to wear one every day, a completely
Correct,
different
one for their shift and toss it.
And of course, with the shortage, that's pretty hard to do, though.
Yeah, that's correct. But luckily, we've been getting a lot of the KN95s here and pushing them out, because if you can get the KN95s into that type of setting, the law enforcement setting, it frees up the N95s to be put back into the medical setting where they're needed, because no matter how many people walking around in public think you don't need to be wearing an N95 when you're walking down the street. You can be wearing a cloth mask.
Now, what's the now in terms of the efficacy wise and like in terms of making like your own makeshift cloth mask, let's say,
Mm-hmm.
versus N95? Obviously, the N95 or K95 is probably better. It's filtering the air. But in terms of compared to wearing nothing, the cloth mask is obvious. The makeshift mask is making a big difference, though, right? In terms of people who can't get the N95 or K95.
Oh, correct. Like we've been saying in emergency preparedness, something is better than nothing.
Yeah.
So, but the cloth mask, as long as you can do it appropriately, it actually has a pretty good barrier, because not only is it just filtering in, but filtering out. So having something so you don't spread to someone else as well. A lot of people don't realize it, but I've seen a lot of people with the vented N95s, and you'll kind of see it where it's in the middle and there's a little vent.
Mm-hmm.
Those are not recommended in this situation, because if you have to go back in the day when N95s were actually being used, they were being used for coal miners. So the vented N95s, you didn't necessarily worry about what was you were breathing out. You were worried about what you were breathing in. So they didn't care if the coal miners were breathing out, flu. They just wanted to make sure that they weren't breathing in coal. So if you see someone wearing a vented N95, yeah, it's great. They're not taking in anything, but they're breathing out. It's basically like an exhaust. They're breathing out what they have. So if you see someone wearing a vented N95 and they're in a clinical setting, you would need to advise them that they need to wear an N95.
Gotcha. So basically it's protecting you, but no one else.
Correct. Which isn't great if you are asymptomatic with COVID-19, because you potentially could be spreading it to other people and not even realize it. And have this kind of false sense of security because you're wearing this vented N95 and you just aren't aware of the, that the fact that you're breathing out something.
Very true, very true. And now, in terms of, segue from the PPE though, now where are you guys, where is your involvement with testing? You said you guys were starting to do a little bit of that.
So I kind of took a back seat with the testing because other people in the public health section that I work with in the state were handling the testing component. However, the warehouse I've been working at for the past 8 weeks, we're going to start centralizing a lot of the tests there at that one location, which makes sense because we already have PPE that's being pushed out of that warehouse location, and our lab is running out of space. I mean, you're talking about a lot of tests, especially in these larger states. So we're going to start storing a lot of the testing supplies at the warehouse, and it's also secure, so we don't have to worry about theft. We have security there, but we have to worry about temperature regulations. And the warehouse where we have our PPE is already temperature regulated, so we can easily track everything since it's recorded. I have weekly temperature logs that I can send off showing that supplies are being kept not only temperature regulated but humidity controlled as well. And we also have a refrigerated part of that warehouse where if we need to keep something refrigerated, we have the capacity to do that.
Now, are you guys having trouble getting with what the media is talking about in terms of the reagents and just the swabs? Like, are you seeing that issue declining, or is that still?
We initially we were having issues in the beginning, but now we have someone locally helping us with the transport media, the VTM, and we are also getting support from FEMA. So FEMA is sending out some supplies to all the states. So we are getting a much more support than we were at the beginning. So I'm starting to see a lot of there were some shortages in regards with PPE, not only PPE, just like medications, because you'll see when something, I mean, if you think about it in a retail setting, if you use one of medication, then that medication's gone because it's economics. When the demand goes up, supply goes down. So what happens in the retail pharmacy? You're like, oh, we'll switch over to this medication, and then that goes away, and we'll switch over. So it's a balance between making sure that you didn't create these shortages in the market that weren't necessarily needed. Just kind of like the KN95s. If you push out something to basically help support that supply chain, it makes shortages decrease. So because of FEMA helping us and then having a state entity help us with the testing, we've gone through, we're going to be okay. So.
Gotcha. And I guess with a lot of what they've been talking about in the media, I'm not sure how true it is. So it's nice to have a good resource here. In terms of when now the governments in each state is starting to kind of reopen a little bit, are you guys really seeing a huge ramp up? It sounds like with testing, is that going to be,
yes.
Obviously in terms of they can't really just be testing 1 or 2% of the population. It's going to, a lot of, obviously a lot of experts are saying it's going to have to be a astronomically larger number than what they've been doing to make it a very, productive and, help prevent a second wave and everything like that, or at least minimize it. So you're seeing a huge up with testing.
Oh, for sure. Not only in the public sector, but also in the private sector. In my area, I'm seeing a lot of urgent cares ramp up with the testing. And then a lot of these larger corporations, like pharmacy corporations, are stepping up and doing a lot of COVID-19 testing. I've talked to a few pharmacists that are out doing it, which is great because in my particular state, pharmacists really haven't, we weren't legally allowed to do point of care testing. But when HHS basically gave us the go-ahead to do it, a lot of pharmacists have been stepping up to do point of care testing, especially with COVID-19. In my state, I see it potentially opening doors to other types of testing, which probably is going to happen in a lot of other states as well, where we could potentially, because I know in some states that pharmacists are able to do more testing than in mine. So I feel like the private sector has helped out extremely much, especially with the testing.
Awesome. And I know you were talking about shortages with drugs. Now you said you were also seeing issues with ventilators and medications for the ventilators. Okay, so you want to dive in a little bit of that?
Yeah. So when you have a patient that's on a ventilator, and I'm by no means an expert in this, I'm not a critical care pharmacist, but obviously when you have a tube and you need to intubate somebody, you have to give them medication to sedate them. So a lot of the medications I saw being used were fentanyl, midazolam, Precedex, propofol, and then strangely, ketamine. Ketamine's been used for sedation in the ventilator patients. And I found out they were using ketamine because they were just running out of drugs. A lot of drugs, so especially fentanyl. And one particular healthcare facility in my area, they had an email sent out. It reached the state office of pharmacy, who sent it to me, but I mean, it broke my heart reading that email. What medications that usually last them 6 months for their ventilator patients was lasting a week. So if you think about that, basically what will last you a month is lasting you a day, and they were going to run out of medication. And I remember this too. It was a Friday, and I looked at the numbers of what they had it was for midazolam, and I was like, they're going to run out on Sunday. And I had to make a few phone calls earlier in that week, and I actually had to get on a federal call. But doctors, nurses, pharmacists, and anyone that's involved in that type of critical care setting, the last thing they need to worry about is running out of medication for their patients. They're already overwhelmed. They're overburdened. They're working long shifts. You can't just add to the problem. And running out of a drug is it's not right in that situation. So when I was talking about that bioterrorism program that I run, that's the federal call that I had to make. So I pulled medication out of that bioterrorism program and sent it to that healthcare facility. And it was actually sent by, I had the courier be the Department of Natural Resources, which I know it kind of blows your mind having someone who runs like a state park courier versed to a healthcare facility for you. But it was actually great because it was, they're game wardens. So they have that police type setting background where they have dangerous drugs, like they have that education and they know how to transport. And it was very interesting. They sent me the tracking. They sent me who signed for it. Like, it was the best courier system I've ever had. Like, I was like, y'all need to get into the into the drug wholesaler courier. Y'all are great at it. I'm basically in a room working with multiple state entities, and DNR is one of them. And they were just walking around joking and going, DNR is moving dope.
Well, it sounds like everyone has to make an adjustment and kind of be, fully adaptable in this situation. It's
Yeah.
It's
But
crazy.
it's super great when you can walk into a room and tell people, I need to get medication to a hospital. And like 3 people stand up and they're like, all right, what do you need? What do we need to do? And it's great because you know that people are going to be taken care of. But that just took a huge burden, especially that facility. I know they were super grateful, but it relieves some of that burden that they shouldn't have to be dealing with. It's not their fault. They had a bunch of cases that hit them in a very rural area. So yeah, it was super great being able to help that healthcare facility.
That's a really cool story.
Yeah.
And I mean, before I do kind of want to jump or also discuss before we close up in terms of where you see everything going, over the next couple months, and in terms of preparing for hopefully something like this we'd be much more prepared next time. It seems like a lot of states, or in general, we were not that prepared for it. Anything else that you're seeing that maybe we're not hearing on the news that just that kind of stands out? I don't think a lot of people realize that the ventilator medications, we were running low on that. I think a lot of people were thinking about retail side, maybe, oh, my medication is we're having trouble getting it. But is there anything else you're seeing that maybe that you found very interesting or wanted to mention?
Yeah, I've heard of shortages in the transport media for the COVID test, the VTM. So I've started having conversations with people about that, because you potentially, almost everybody in this country wants to have a COVID-19 test. So making sure we have enough VTM for that test. Also, I'm extremely worried about this upcoming fall with flu season. We need to get in a better situation where we have enough PPE for flu season. And then also, I feel that this is, I hope I'm wrong, but it's my professional opinion, is that COVID-19 is going to come back in the fall. And then you're going to have cases where people are co-infected with flu and COVID-19. So making sure we have enough PPE for that situation, and making sure that the healthcare system isn't as overwhelmed, and in my state, I feel we've done a good job. So I'm more prepared to face that situation, especially if we run into drug shortage issues as well. Also, just kind of sending this out for anybody listening that's in retail, we need to start preparing for a vaccine, because if it's something that someone can make money off of, especially in pharmacy, they're going to do it. So just preparing to actually have enough cold chain management for COVID-19 patients, because if you have a vaccine, from what I'm reading, and I'm not sure what you're reading, Chris, but the data I'm reading says perhaps we'll have a vaccine in January.
I've heard
So
that. Yeah.
can you imagine having people and not only come in for flu shots in January, you're going to have a line out the door for COVID-19 vaccine. Yeah. So making sure you have enough supplies for that, because I guarantee you they're going to run out of they're going to run out of needles, they're going to run out of alcohol swabs.
I know when back in my retail days, when flu season, in terms of you had a rush that week or month, there would be times where you'd be getting kind of close to your needle supplies or needs or whatever. I couldn't imagine I couldn't imagine having to worry about both. You're going to need one pharmacist just to do vaccines, basically.
Yeah. We're going to have to think of a way to, conserve PPE, especially when it comes to gloves. We were running short on gloves during all of this. It's scary when you think about it. I really hope after all of this, we actually have some industry that comes back into the United States, so we can have some local manufacturers for something like simple, like gloves.
Yeah. I feel like that's one thing that surprises a lot of people, right? In terms of the PPE shortage, the gloves, the gowns, the masks, everything, where you would think, how is this possible?
Mm-hmm.
I agree there. I think that would be something where we need to try to not be as codependent to other countries or other places where they do distribute and manufacture that kind of supply, that we would be able to have it on our own
Agreed.
In our country, so we wouldn't be so dependent in terms of this. We're right where we are, basically.
Agreed.
But where do you see, in terms of, I know we see, vaccine hopefully in the pipeline, which is, we've unheard of to get it done this fast.
I know, right? The FDA has been pushing out so much stuff so quickly. Yeah. I'm like, oh my gosh.
It's incredibly fast.
Yes.
I want to say, I may be wrong, but I want to say I heard something like over 100 companies are working on, or currently trying to work on developing potential vaccines. So
there's money to be made.
Which is, and I think, like, basically they're saying they're going to, when they have a potential one that they think is going to work, they're going to send it right out once they determine it's safe, just to try and get ahead of it. So what do you, in terms of with what you see every day at work and what you're seeing in person, where do you see in January, what picture can you paint? What do you see? Because I feel like everything is going to be completely different. I don't think we're going to go back to 100% normal.
And we're going to be doing things that we didn't realize we in the pharmacy, I know people have been doing things that I didn't realize they were going to be doing. I was talking to pharmacists that told me, I'm turning away vaccines because I don't have an N95. I can't vaccinate somebody. And I was like, if you don't have the PPE, that puts you in that healthcare setting. So we're going to have to be prepared and make sure that we have the proper PPE to do vaccinations. So just starting to prepare for that in January. And then even if you have like a box of something that's PPE that's expired or is going to expire, do not throw it away, because just like medications, when we run into emergency situations, they'll extend the expiration dates on that PPE. So if you have something that's going to expire that you think you can use in January, I would stash it, especially if it's in the pharmacy, because again, you have those temperature controls and the regulations, so you can show that it was kept under, the room temperature setting. But we're going to have to think about in the pharmacy too. I know a lot of places may not have enough space for, I predict some places are going to need just a separate fridge for COVID-19 vaccine. So, and staffing, I've heard like 3 or 4 people say this, but it's kind of been the wild, wild west of pharmacy lately.
So, I've heard, yes.
I know we've been doing things that we're not necessarily comfortable with because it wasn't legal at some points, and those rules have been somewhat, I'm trying to think of a word for it. It's been, I guess, relaxed in this emergency situation. But I would just caution people to, like I said, just start preparing as best as you can and stocking up on, if you have a box of clubs, stash them away. And, during the COVID-19 testing, I was training students that this sounds really weird because we're used to taking off gloves and throwing them away, but they were saying if you have hand sanitizer, you can put hand sanitizer on your gloves, and hand sanitizer gloves. That way you're not sitting there and taking time to take your gloves off. But also that you're also not, a lot of people, when they take their gloves off, they take them off incorrectly and you snap them. So you potentially can expose yourself in that situation. So it's actually safer for yourself if you sit there and hand sanitize your gloves and keep on going. I know it sounds weird, but if you think about it and work your way through it, it makes sense.
No, that's very good advice. I mean, I feel like it's an unprecedented time. Like no one would have imagined it to be like to turn out this way. Even talking 2 months ago, even when it started, or not even, probably 3 months ago when it kind of started hearing about this. I feel like no one really took it as serious as they should, or at least didn't think it was gonna turn out this way. So I feel like we're learning a lot, like what you're talking about. I feel like we won't make the same mistakes, and again, second time. And I'm hoping there isn't a second wave. I'm hoping that's not going to turn out that way. But I mean, I think it seems like it's inevitable that it most likely is going to come back with the flu season. So I think the more prepared we can be, the better. And and I feel like this has been awesome information. Thank you so much. I really appreciate it.
Thank you.
And I was going to just throw out there really quick. Do you think with the vaccines, once it gets to that point, do you think it's going to be something where they're kind of like right now where they're doing the drive-through testing? Do you think they're not going to want people to come in for the vaccines? They're going to want to do it outside, or like a completely different entity?
Yes, I believe so. And it depends on a lot of things that happen, but potentially you can see what happens where public health had the COVID-19 testing before the private sector did. We might run into a setting where public health, through vaccine programs, has the vaccine before the private sector does. So you might see a situation where you have drive-through vaccine, like where you're giving a vaccine through the car. Yeah. Very strange for some people.
Well, I think that's very safe, though, too, in terms of if we still obviously don't know, especially with people being asymptomatic, it's very hard to know. It's like you said, like with a pharmacist not being able to give a vaccine if they don't have gloves. I mean, you're very vulnerable when you're right next to someone giving them a vaccine. So it kind of came to my head. I was like, maybe it'd be a good idea to not have everyone drawn to the pharmacy, because it just puts more people at risk as well.
No,
so
it makes a lot of sense, especially during this situation. I talked to a lot of independent pharmacies, and they were having their patients just call and say when they were in the parking lot, and then sending someone out there, or just having a cashier outside, walking back and forth. It makes a lot of sense because it just decreases the exposure.
Absolutely. Well, thank you so much. We covered so much. I really appreciate it, Tracy.
No problem.
Thank you so much for your time. Thank you for being on the podcast.
No problem. Thank you.
Well, thank you guys so much again for joining us today on the Happy PharmD podcast. I hope you got a lot of useful and helpful information from a pharmacist's viewpoint regarding the pandemic. One thing that we did not have enough time to mention, but really highly encourage, is that if you are in fact interested in assisting with the COVID-19 response, we would highly encourage you to contact your local health department to volunteer your time and expertise. Your local health department could potentially be experiencing staffing shortages during the pandemic, and most likely are, and you could possibly assist during this trying time and make a huge difference. So we highly recommend that. Please feel free to reach out to your local state department, local health department, and try to get involved and help out with this trying time. Lastly, we just want to also mention our free webinar class that we are still offering at thehappypharmd.com/begin to help pharmacists escape burnout, get job offers regularly, and finally take control of their career. Again, that is at thehappypharmd.com/begin and is 100% free. Thank you guys so much, and we'll see you next time.